How you doing today?
I'm good again.
I am great. My name is Daylon, and I'm going to be giving you your head-to-toe assessment. First, I'm going to provide privacy. I want to wash my hands and gather my supplies. Okay. I am back. I would like your name and date of birth.
Shia Purnell, 06/20/1992.
Okay, I'm going to check your wristband. Okay, wristband, name and date of birth identified. Okay, are you in a comfortable position?
Yes.
Okay, so posture is good, speech is clear. I'm going to ask you some generalized questions, okay?
Okay.
Do you know what year it is?
Yes.
Do you know where you're at?
Yes.
Okay, so next we're going to go into your hygiene, just off appearance. Everything is good. Okay, so next I'm going to check your head, ear, eyes, nose, and throat. So first I'm going to look at your head. I don't see any abrasions, any wounds, any lesions. Hair is not brittle. No abnormalities noted. Okay. So now I'm going to assess your cranial nerves. It's okay for me to touch you, correct?
Yes.
Okay. So we're going to start with cranial nerve number 5, which is your trigeminal nerve. And I'm going to rub the top of your eyebrows with this cotton ball. I want you to tell me if you can feel it by saying yes.
Yes.
Okay, great. So cranial nerve number 5 is intact. Next, we're going to check your cranial nerve number 7, which is your facial nerve. I want you to smile for me. Okay, perfect. So cranial nerve number 7 is intact. Next, we are going to check your eyes. Let me get my pen. Okay, I'm going to point a light in your eyes. I just want you to look at the light. Okay. No redness noted, no discharge noted. Everything seems to be fine. No abnormalities noted. Okay. So now we're going to look at cranial nerve number 3, 4, and 6, which is your oculomotor, trochlear, and your abducens nerve. So with this, I want you to follow my pen, and I'm going to go to, just follow my pen with your eyes, okay? Okay, great. So cranial nerve 3, 4, and 6 are intact. Next, we are going to look at cranial nerve 9. You know, optic nerve, cranial nerve number 2, just your optic nerve. Now with this, I'm going to ask you to put one hand over your eye. And then I'm going to pull up numbers in each quadrant. If I'm going to get down. And I want you to tell me what numbers I'm holding up, okay? Okay.
4.
Just move your eyes.
4. 4. 4. 4.
Okay, now switch arms.
3. 3. 3. 3. 3.
Okay, great. So cranial nerve 2 and optic nerve is intact. Next, I'm going to inspect your mouth. Okay, so we're going to do cranial nerve number 9, 10, and 12, which is your hypoglossal nerve, vagus nerve, and glossopharyngeal nerve. Okay, so I would like for you to say ah.
Ah.
Okay, so on inspection, your mucous membranes are red, no missing teeth, no lesions, no open areas. Can you swallow for me? Okay, can you stick your tongue out? Okay, can you wiggle your tongue back and forth? Okay, symmetry is noted. So everything looks good, no abnormalities noted. So cranial nerve number 9, 10, and 12 are intact. Okay, so next we're going to inspect your nose, okay? So I just want to check for patency, no deviations. Can you put one finger on one nostril and blow? Another finger on another nostril and blow. Okay, so that is great. So next we're going to assess cranial nerve number 8. No, cranial nerve number 1, which is your olfactory nerve. I want you to smell something, okay? Tell me what it smells like.
Cherry.
Okay, so cranial nerve 1, olfactory nerve is intact. Okay, so next we are going to do cranial nerve number 8, which is your vestibulocochlear nerve. And for this, I'm going to make noises with my hands. I want you to tell me yes if you hear a sound.
Yes. Yes.
Okay, cranial nerve 8 is intact. I'm just going to look in your ear to see any excess cerumen. Okay, everything is fine, no discharge. Cranial nerve 8 is intact. Okay, so next we're going to cranial nerve 11, which is your accessory nerve. I want you to push against my resistance. Shrug your shoulders. Okay, push against my hand. Okay, great. So cranial nerve 11, which is intact. Okay, so next after that, we are going to do your lymph nodes, okay? Okay, so we have pre-auricular, post-auricular, occipital, submandibular. We have anterior cervical, posterior cervical, supraclavicular, and tonsillar. And then we have submental. Okay, so with me touching in those areas, are you having any tenderness, any pain, anything?
No.
Okay, that is great. So next, we are going to the thorax. So first, I am going to assess breathing, respiratory rate, depth, and size of your chest. So just from inspection, I see that you have no barrel chest. You are not using any accessory muscles for breathing. You have no cough, so no abnormalities detected. Next, I am going to check your spinal alignment. So I'm going to come around. I want you to move up a little bit. Thank you. Okay, spinal alignment is normal. Okay. Next, I'm going to check for CVA tenderness. You can turn back for me. Any pain?
No.
Any pain?
No.
Okay, great. So CVA is in no pain. That's great. Okay, so now I'm going to auscultate your breath cells, okay? So every time my stethoscope touches your skin, I want you to breathe in, okay? So we're going to start from the front. Breathe in. Breathe in. Okay. Breathe in. Okay. Lift up your arm. Okay. Lift up your other arm. Okay. Everything sounds fine. Transverse ratio is 2-to-1. AP ratio is 2-to-1, which is normal, so that is great. So next we are going to do the carotid pulses, okay? Okay, so we have, I'm gonna do it one at a time. So, normal, normal. Okay, great. So next, we are going to check your aortic valves, okay? To auscultate for breathing. Okay, so we have your aortic valve, pulmonic valve, Erb's point, tricuspid valve, and right here we have your mitral valve, and everything sounds fine, so that is great. That is really good. Okay, and so next we are going to you can lay down.
Lay down, face down?
You can just lay straight back. And I'm going to inspect your abdomen. When I touch you, just let me know if you have any pain, okay? Any pain?
No.
Okay, great. Okay. I'm going to auscultate all 4 quadrants right now, all right?
Okay.
Right upper left quadrant intact. Lower left quadrant intact. Left upper quadrant intact. Left lower quadrant is intact. Okay, great. Okay, and then we are going to, okay, so that's that. So we're going to keep going. Are you okay?
Yeah, I'm comfortable.
Okay, so when is the last time you had a bowel movement?
Today.
Okay, and how's your urination been? When the last time you know, your urine?
Today.
Okay, great. So that's all intact. Okay. Okay, so next we are going to stand up. Okay. And I'm going to assess your extremities, okay?
Okay.
Okay. So put your arms out. Okay, raise them down. Put one leg up. Okay, put it down. One leg up. Okay, put it down. If you could sit down for me real quick. I'm just going to check for edema, tenderness, and temperature in your arms and legs, okay?
Okay.
So, you put your arm out. Okay, wait. Okay, normal. Put your leg out. Okay, no edema noted. Okay, no edema noted. Now I'm going to check your capillary refill in both your arms and your feet. Okay. Okay, no greater than 2. Less than 2. Less than 2. Less than 2. Okay, great. Okay, so now, I want you to stand up again. I'm going to do something called the Romberg test, okay? So I want you to close your eyes, and I'm going to push you just slightly, and I want you to spread your feet out a little bit. Okay, great. Romberg test is positive. Okay. So, can you do a windmill to your head? Can you turn your windmill your arms? Okay, great. Can you move your legs for me again? Okay, great. Okay, so next, I want you to push against my hand. No, put your arms up like this and push against me. Okay, I want you to sit down. And then I want you to push against my hand. Okay, great. Okay, strength is present in all 4 extremities. Okay, so now we are going to assess all of your pulses, okay? Okay, so we have radial. Okay. We have brachial. Then we have popliteal. No, you good. Just put your legs out. Okay. Then we have posterior tibial. And then we have dorsalis pedis. Okay. All pulses are intact. So now, are you comfortable?
Yes.
Okay, so I'm gonna go I'm gonna go after I wash my hands, and I'm going to get the doctor, make some documents. I'm gonna give you your call light. Here's your call light. And if you need anything, you can let me know. You can always ring the bell, and I'll be back to let you know what the doctor says.
Okay, thank you.
All right, thank you.